This is George Marinos here for Rhino Charge TV. I'm here with Dr. Jason Shu of Shu Orthodontics in Hanover, Pennsylvania. Good morning. It's good to be here with you.
Morning, George. Thanks for having me.
Yeah, no problem. On your website, your mission statement says that you want your orthodontic experience to be fun and positive for all your patients that come here. Could you explain a little bit about what that means?
Sure. We really pride ourselves on the experience that folks have coming through our doors here. And we know that the expectation of us as a healthcare provider is to provide the absolute best quality care. And that's what we hold ourselves to. But beyond that, we feel like there's every reason why it could be a fun experience while you're here. And we have a wide age range of patients. Our youngest patients that may be entering treatment could be as young as 7 years old, and we have plenty of adults who are starting treatment as well. So we cater to all ages, but in the process of our day, we really pride ourselves on making the experience here the best part of our patient's day.
You mentioned having a wide range of patients, including adult patients. I think a lot of people are under the misconception that orthodontics are kind of for younger kids, kids with braces and stuff like that. What's kind of your message to adults that may be unsure of whether or not they need orthodontic services?
Yeah, sure, George. The bottom line is as long as your teeth and your gums are healthy, we can move your teeth at any age. So there's no age restriction on orthodontic treatment. We do like to see kids because if we catch things early enough, if there's a particular type of issue, we may be able to help guide growth to help solve a problem or prevent a problem from ever occurring. So we do see a lot of children, but actually the surprising statistic is within orthodontics that the fastest segment of a patient population that's growing would be adult patients. So we have plenty of adults who come in and say, I took care of my children, or in some cases I took care of my grandchildren, and now it's my turn. So we see that quite frequently, and pride ourselves on seeing adults as well as children.
Mm-hmm. What's your message for people who've maybe had a bad experience somewhere else in the past and are a little bit afraid of going through orthodontic treatment?
Sure. I think we're lucky as a group in the Hanover community to have great dentists available, great dentistry available. And as with anything, the experience going to different offices is going to be different as well. And so, again, our focus is making the experience as positive as possible. And one of the nice things about orthodontics is most of the stuff that we do has some flexibility as far as timing. So, for example, if someone's had a bad experience and doesn't necessarily like going into a dental office, number one, we feel like the environment we've set up here does not feel like a traditional dental office. And number two, with having some flexibility as far as timing, we can stall a little bit if need be and just let someone come in. We have folks who will come in who will just spend time with us to kind of get acclimated to the environment without us really doing any sort of procedure or any sort of anything that's tooth related, just to get comfortable with us and with our team. And the nice thing is we can work at their pace to help get over some of those fears or some of those anxieties. So that's something we pride ourselves on and get quite a bit of joy out of helping folks over those obstacles.
Mm-hmm. Why did you guys feel that it was especially important to sponsor the Hanover Rhinos football team?
George, so we really pride ourselves also on being a part of the community. As with any business, we wouldn't be here without the community and without the community support. We've been here just over 7 years now, and the success that we've had in the community is thanks in total really to the community itself. So we pride ourselves on giving back. We have different areas in the community in which we like to give back. We have our charities of the month, so we try to get involved with local charities. But we also recognize that there are many areas within Hanover that contribute to this being such a great community and such a family-oriented community. And the Hanover Rhinos, being the semi-pro team for the area, are obviously involved in entertainment and bringing some of that family value to the area. So if we can be involved in that and help out in any way possible, we know it's expensive to play sports. We know it's expensive to be involved in those particular activities. So if there's something we can do to help alleviate some of that, we're willing to help out.
You had mentioned before when we were talking a yard sale that you have for charity coming up. Could you talk a little bit about that and when that is and how people can get involved in that?
Yeah, we have a community yard sale that we're setting up coming up. Actually, it's a yard sale that our office is setting up that's going to be on Saturday. I believe it's Saturday, May 18th from 8 a.m. to 3 p.m. And basically, we're just looking to gather goods that folks are willing to donate. And all of the money that we make, every penny that we make, is going to stay local here for what's known as Focus Foundation. And so we're just trying a different way to raise money for the charities that we work with. We typically pick a charity. We call it a charity of the month, but we'll often work with them over a few month interval or even over a quarter of a year in raising money. So we cycle through and try to help out as many of those local charities as we can. The one that we're currently working with is Focus Foundation, so we thought we'd try something different and hold a yard sale. We thought spring would be a great time to do that, and so if anyone's willing to donate items to that yard sale, again, every penny goes back to Focus Foundation and it stays local here. And so that, it's coming up here within the next few weeks.
You just talked about being very involved in the Hanover area, being from outside of town, being from the Pittsburgh area. What was kind of the driving force behind coming here to Hanover and getting involved in the Hanover area?
Sure, yeah, there are a couple of factors that played into us to our family moving to the Hanover area. Number one, I grew up in a small town outside of Pittsburgh, a very blue collar town, farming community, and it was very much a huge influence on me was just the whole idea of neighbors helping neighbors. If someone needed help with something, it was a phone call away and someone would be willing to step up and help you with whatever was needed. The small town that I grew up in was very family oriented, and knowing how much of an positive influence that had on me, I thought it was important to have my children experience that as well, or have our children experience that as well. So the small town atmosphere of Hanover fits very well. The other factors are, we have great proximity to larger cities for all of the cultural and entertainment value that larger cities bring. Dr. Fischel, who was my partner when we were FNS Orthodontics and Periodontics, prior to being Shoe Orthodontics, is actually from New Oxford, so that was a big influence as well. And the final piece to the puzzle is basically all of my family's in the Pittsburgh area, with the exception of my brother who lives in Delaware, so Hanover's a nice middle ground between those two as well. So a number of factors that played in, and like I said, the office has been here about 7 years now, and we've really been happy with being part of the community.
Another factor that you guys had to starting the FNS Orthodontics business here, that happened while you were in college at Penn State. You go through that story?
Yeah, so FNS Orthodontics and Periodontics, we had two specialties under one roof, orthodontics and periodontics. Orthodontics being the specialty that's more with straightening the teeth and the bite with braces or clear aligners. Periodontics is more focused on gums and things like dental implants, replacing missing teeth, that kind of stuff. Dr. Fischel is trained in both of those specialties, and so he was able to bring both of those specialties under one roof. And so together we had created FNS Orthodontics and Periodontics. He had actually started it even before I came on board over in Red Lion. And Dr. Fischel and I met at Penn State just kind of randomly in a biology course. At the time that we were at Penn State, at least, it was not nearly as common to have someone interested in dental school as it was someone interested in medical school. So I just remember him reading a pamphlet or a book about information on dental school prior to one of the lectures starting, and kind of struck up a conversation and a great friendship that resulted from that. And that culminated in, he actually finished Penn State a year prior to me. He completed his undergrad studies in 3 years, went on to Harvard for dental school. I was looking to go back to the Pittsburgh area since all of my family was there. And when it came time for me to apply for dental schools the following year, he was really influential in me even applying to Harvard as well. And I ended up going there as well for dental school. And then Dr. Fischel did both of his specialty trainings at University of Pennsylvania, and I did orthodontic training at Maryland. After the training was complete, he went on to work for a group of periodontists in the Harrisburg area. I was working for a group of orthodontists in the Baltimore area who were my instructors. And we had decided basically at some point to go out on our own. He started the first FNS office over in Red Lion, and then a few years later I started the Hanover location. And that's pretty much how it all started, as a friendship that dates back to Penn State.
FNS was here for 7 years, and then within the last 2 years you guys rebranded to Shoe Orthodontics. Could you talk about what differences that has meant for your brand here?
Sure, yeah. So this FNS location was here for about 5.5 years, and we've been Shoe Orthodontics for about 1.5 years now. A couple of the driving factors were, number one, when we were F&S, Dr. Fisher was over here once every other week, and I was going over to one of the York offices at the same time that he was here. So it was basically one day every other week that we were switching off. I live here in the Hanover community. He lives over in the York community. So we got to the point where we just decided basically to keep the office separated. I was running the office here, and we had a separate team here compared to our team that was over there for those two York offices. And so we made the decision to keep the office separated, keep the offices separate. He kept the F&S name for the two offices over in York, and we rebranded to Shoe Orthodontics here. The downside of that was that we no longer offer periodontal services here and solely focus on orthodontics. The big plus from my standpoint was being able to focus solely on the Hanover community, because this is where I live. This is our sole office location at this point, and it's just allowed us to really put quite a bit of our focus on community involvement, just specifically here at Hanover.
Talk about your work with Cleft Palate.
So Cleft Palate is a special interest of mine. Cleft Palate being a situation where basically at birth, or technically before birth, the roof of the mouth doesn't completely form. So folks may be left with a void or a hole in the roof of their mouth. And so that's something that had kind of gained special interest from me when I was in training. Some of my research, I was lucky enough when I was in training at University of Maryland to do some research with Dr. Rusty Long over in Lancaster's Cleft Palate Clinic, which is world renowned. And so through doing some of my research there, just gained even more interest in treating folks with cleft lip or cleft lip and cleft palate. And so that's led to me seeing some folks here in the office. I will say, as far as that's concerned, a lot of the current model for treating folks with cleft is more of a university setting or a specialty center setting, which is awesome because it allows those folks who are in need of treatment to see all their specialists under one roof. Where we can be helpful here is that, for example, some of our patients, their cleft treatment as far as team-based approach occurs at Johns Hopkins main hospital facility in Baltimore. That's quite a drive for regular routine appointments that may occur every few weeks to every few months. So being a local provider for those folks who live in the area is great, and we try to coordinate care with those larger centers. So it's been fun to be a part of that.
You also have an interest in Disney movies and did some work with the Disney Institute. Talk about some of that stuff that you did.
Sure, yeah, George. So Disney, obviously most folks know Disney for movies, for their entertainment, for their parks, for their cruise line. One of the things that Disney offers is known as Disney Institute, and it's been in existence for years now. It's basically a segment of Disney where they say, hey, you know what, we realize that we've had a lot of attention for how we do certain things so well, whether it's customer service, how we can manage to get hundreds of thousands of visitors through a park in a given day, how we can coordinate 80,000 employees in one location in Florida to give consistent customer service. So a lot of outside businesses have been approaching Disney for years and saying, how are you guys doing this and how are you doing it so well? And so Disney had started the Disney Institute years ago as a training mechanism to allow other folks to come in from outside organizations or outside businesses to learn kind of some of those secrets. And so I took a Disney Institute course about 3 years ago down in Florida on leadership excellence, and really kind of fell in love with their model of how they do things and how they do things behind the scenes, and really felt like what they were doing behind the scenes was genuine, and what they were doing for their guests was a genuine representation of how they truly felt about how their business should operate. And that's what I wanted to instill in our office here. So we started implementing some of the things I learned from Disney Institute a few years ago, and we've since just recently re-engaged with some of the instructors that I had from Disney Institute, who are now working separate from Disney in their own consulting group. So we're kind of their guinea pig for small businesses. We're currently the smallest business that this particular group has worked with, and we take great pride in that, and great pride in helping them to facilitate an experience that will be more useful for other small businesses as well.
All right, Dr. Jason Shu, thanks for joining us today. This is George Marinos for Rhino Charge TV. Remember, you can follow us on https:// HanoverRhinosBlog.wordpress.com. You can also visit Shoe Orthodontics. Your website is shoeorthodontics.com.
Shoeorthodontics.com or shoeortho.com, and it's SHOE, ortho.com.
All right, and thanks for tuning in today. We'll be back with some more content later on in the week.
Thanks for having me, George.